And welcome to another show. Well, September, it's Prostate Cancer Awareness Month. And I have a very special guest in Dr. Ian Thompson. Now, we need to learn about the importance of early detection for this common cancer and the available treatment options for men. Now, with this in mind, I'm fortunate to have Dr. Ian Thompson on today's show. He's from the Texas Urology Group. And by the way, folks, this interview, I'd like to mention this, that it represents a collaborative education activity between Dr. Ian Thompson and the Boston Scientific Corporation. So in other words, this physician is not compensated for his time. Okay? That's good. Anyway, welcome, Doc. How are you?
I'm doing great. Thank you. Nice to be here.
Most welcome. Well, with September being Prostate Cancer Awareness Month, and when it does come to men's health, prostate cancer screening, I mean, it should be a top priority. You agree?
I do agree.
Yes, it's one of the most common cancers in American men. What is it? 3.1 million men living with the disease currently. And while identifying the disease in its early stages is often difficult, isn't it, with regular screenings? But what if detected early, what happens?
Right. So you're exactly right. And here in the United States, it's a very common. Behind skin cancer is the most common cancer in American men. Nearly 250,000 new cases will be diagnosed. And for those men that have prostate cancer detected early, there are several options for treating the prostate cancer. And those treatment options can include surgery, where we remove the prostate, radiation, where we kill the cancer cells down in the prostate with radiation. And sometimes men are diagnosed with low-risk prostate cancer that we can just keep an eye on and watch, and that's called active surveillance. So those are really the three most common options that men will have when diagnosed with localized prostate cancer.
So for men who are diagnosed, understanding their treatment options as well as their, potential side effects, it's critical to them, right, doctor? I mean, what are some common treatment options these days?
Right. So for those that are diagnosed with prostate cancer that's just in the prostate, be it the treatment options being surgery, radiation, and active surveillance. For those that are diagnosed with cancer that's outside the prostate, usually more medical treatments for those. But what we do know is that there are potential side effects for the treatment options that we have. And the most common side effects that we see for surgery may include leakage of urine or urinary incontinence, erectile dysfunction. Most common side effects we see with radiation treatment can include urinary symptoms or effects of the radiation on the rectum. So not only do we think about it as physicians, but also from a patient perspective, when they're having those conversations about which treatment option is best for me, it's about weighing out some of those potential side effects of the treatment and also exploring what options are available to help mitigate or reduce the side effects of those treatment options.
Well, we're going to talk about something special in Spaceoar in just a sec, but, with what you just mentioned, Doctor, I mean, it's enough to scare the living daylights out of a guy, isn't it? I mean, that's a barrier for them wanting to find out. I mean, it's important to find out, but, on the left hand, gosh, truth, I'm going to lose all of this, and that. On the right hand, well, I need it done. I mean, you flip a coin, huh?
Yeah, and that's where it's important to have those conversations, because when you do this, a lot of men just kind of think, oh, I don't even want to think about that, so I'm just not going to check. I'm more worried that fear of the side effects prevents them from even asking the question, and getting screened and getting checked. And sometimes when you can get past that, know there are treatment options, even when the side effects do occur, we can do stuff to fix those things. Mm-hmm. We can do stuff to reduce those risks of the side effects. So let's just check in, and it can say, screening and early detection does save lives. So.
Oh, big time. From my research, which is not a lot, but I mean, you're going to explain more, thank heavens, but this Spaceoar, trademarked in fact, I mean, Hydrogel is an absorbable gel that creates a temporary space between the prostate and the rectum, and it's designed to reduce the radiation close to the rectum, thereby minimizing potential side effects and negative impact on urinary, as you said, sexual and bowel quality of life. So let's talk about the importance of having an open dialogue with your doctor about regular screenings, finding a treatment plan that's best for us men, without sounding sexist, if we have received a prostate cancer diagnosis and options, including this Spaceoar Hydrogel?
Right. So you highlight exactly. It's having that conversation and weighing those benefit and risks, and things like this Spaceoar Hydrogel that can be utilized to help reduce. And for those men, reduce the side effects. So for those men that are electing, after having explored all the treatment options for their prostate cancer, if they elect for radiation, the conversation can go to, hey, what about Spaceoar? And for those listening, Spaceoar is a minimally invasive procedure. Takes maybe 20 minutes to do. It can be done in the doctor's office, where we place this small needle, and we're able to take what is really a small space naturally between the prostate and the rectum and create a much larger space by placing this hydrogel that will last for nearly about 6 months. After about the 6 months mark, all that hydrogel is reabsorbed by the patient's body. And the nice thing about this procedure is that most patients don't skip a beat. They're able to get back to their regular activities later that same day or the next day after having this Spaceoar gel placed.
No, that's really important. So, fellas, if you want to read about that, write this down, www.spaceoar.com. It's one word, SPACEOAR, spaceoar.com. Now, doctor, how common really is prostate cancer? Why is regular screening for this disease so important?
Right. So here, in the United States, about 250,000 men will be diagnosed this year alone. So it's very common. And as you mentioned, about 3 million men living with the disease now. So if you live long enough, as you get older, that risk, it does, increase. So, and the other things that increase the risk are family history, not just of prostate cancer, but we also know that family history of breast cancer and ovarian cancer can sometimes influence a man's risk of developing prostate cancer. So knowing what your family history is from health conditions is also important when it comes to thinking about screening.
Yeah, I mean, I had a very dear friend pass with it, and you wonder, what is it? Is it the food we eat? Is it something we do? Or is it just hereditary? I mean, can you put your finger on it, Doc, why we get this thing?
That's almost $1 million question there. It's really multifactorial. Some of it happens from genetics, and some of it just happens where it develops. A lot of times, there's not a lot of data to say it's this food or that food. There's been research to look at some of those things. Those are hard studies to actually conduct, but it's a lot of it's just kind of family history, but also, and sometimes it can just develop in men without having a family history. But I think the important message is for just living healthy lives, exercise, weight loss, eating healthy. Those things have huge impacts on your overall health as well. So it's important to address those while we're talking not just prostate cancer, but overall health of men as well.
Right. Well, we're just about to wrap up. I really just wanted to touch on this again. This site, do you understand what's on this site and what's so good about it that people should really visit it? I mean, there's plenty of information there, right, on spaceoar.com?
Yes. And I think that is so important, like you mentioned, is patient education. When I am having that new diagnosis conversation with a patient, this is the way I phrase it. I say, you, sir, are the captain of the ship. My job is to play navigator. My job is to give you as much information because I want you to go into and make that treatment decision with full confidence. And you can only have that full confidence when you're armed with all the information. And so resources like that website, spaceoar.com, resources like from the American Cancer Society or the American Urologic Association, read. So I really encourage patients, because when you have that diagnosis, it can be overwhelming. So you have that conversation, go home, take the information I have, read more. We're going to come back. We're going to talk about it. We're going to answer questions. So really, to your point, that website's important. It's one great resource for information.
Well, thank you, Doctor. We have to go now, but folks, Dr. Ian Thompson from the Texas Urology Group. And as I said before, he represents a collaborative education activity between himself and the Boston Scientific Corporation. He was not compensated for his support in this, and very enlightening. Thank you, Doctor. You heard it here with another episode on The Mark Bishop Show. You have a good day now.